ultrasound and MRI results matter for your wrist and hand pain? Not really, but let me explain. Over the past 8 years, we've noticed a belief that imaging like MRI, X-ray, ultrasound, and even nerve conduction tests provide a clear diagnosis for repetitive strain injuries of the wrist and hand. This is likely associated with the way doctors may be describing imaging in their discussion with their patients. There's a big difference between the imaging will tell us what's going on, let's get some imaging to figure out what's the problem, I'll order an MRI and we'll get some answers, and we'll see what we find in the imaging, but know that we have to use that information on top of what we know about your injury, how the pain behaves, to determine the right diagnosis. It should always be approach number 2. But unfortunately, due to our healthcare system and how behind many primary care providers are in their recommendations, it's almost always number 1. Or the first few options. And there are some real consequences with that. Imaging and ultrasound doesn't matter as much as we think, and I'm gonna prove it to you through this video. Let's first talk about what imaging is typically ordered for RSI issues at the wrist and hand. Most typically we hear X-rays, MRIs, and ultrasounds. Each imaging technique has their benefits in visualizing certain types of tissues. And in many cases, we see overutilization of things like X-rays. X-rays are good for seeing fractures, dislocations, misalignments, and narrow joint spaces, but they can't show soft tissue problems. These are generally ordered since they are more affordable, but honestly, many healthcare providers overutilize them. Magnetic resonance imaging, or MRI, is good for seeing muscles, ligaments, tendons, organs, and other soft tissues. A majority of our patients seem to have had MRIs ordered, with 60% of our patients this year who have been dealing with the problem for more than 3 months getting an MRI. And there are different techniques that can emphasize different tissues, from T1 to T2 to proton density imaging. And the contrast between the tissues and the presence of certain coloring, white for example, can indicate if there's water present, which can suggest some swelling and inflammation. And in this picture, it shows a complete Achilles tendon tear. Ultrasound is typically the most cost-effective option for soft tissue issues, especially if you're trying to visualize more superficial tissues, especially those in the wrist and hand, because there's less layers at the tissues here. Ultrasound also provides a greater detail compared to an MRI for more of the superficial structures. And similarly with ultrasound, the presence of excess fluid can be indicative of tendon pathology. The image below shows a left and right comparison of a tendon with swelling present and thickening of the tendon. If imaging is ordered, ultrasound should be the first option due to its accessibility. And generally, imaging is best utilized to rule out more serious conditions than rule in a tendon being the cause of the problem. Basically, they're not always necessary. And there are mountains of research over the past 2 decades that have shown that imaging, not only for the wrist and hand conditions, but issues at the shoulder, neck, back, and foot do not provide enough information for a diagnosis. In this study done in 2016, 19 asymptomatic professional baseball pitchers went through a detailed clinical exam, and 3 MRIs of their dominant shoulders were taken before contract signing. And guess what? They found that 68%, or 13 out of the 19 baseball draft picks, showed tendinopathy. 32% had a partial tear, or 6 out of 9, of the supraspinatus tendon. 21% had AC joint osteoarthritis. And many other small lesions were found in the subjects. But here's the kicker. None of them had any pain. These results and studies have been repeated in 634 runners, 3,000 individuals for the lower back, and at least 20 other studies, including several systematic reviews and meta-analyses, which have shown that altered tissue states in imaging does not always correlate to pain. You can see all of the references on the screen or in the description, but the research is clear. What we know is that changes in the tendon tissue can be present with imaging, but by itself, it does not mean anything. Instead, only when you layer on the results of a comprehensive clinical exam, which takes into account all of the details of the patient history, activity, and behaviors, that you can really make a decision with imaging results. And in some cases, imaging can make things worse. There are many reasons why this can happen, but one of them being the altered behavior and beliefs about your pain and injury as a result of what you're hearing or understanding about your injury with the imaging results. So one study found that for work-related acute low back pain, MRI within the first month was associated with an 8-fold increase in the risk of surgery and more than a 5-fold increase in the subsequent medical costs when compared to control patients who did not have early MRI. And so what we believe about our pain and our experience maybe with healthcare providers, with what we find online around the injury, can influence what we believe, how we perceive our pain, and how sensitive our injuries might feel. If we believe we're unable to move because we have a herniated disc or disc degeneration, then we tend to move less. We perceive that our bodies are fragile, and that leads to real physiologic changes that are detrimental to back pain. If we believe we have to rest because our nerve is being compressed through carpal tunnel syndrome, then we'll avoid the activity that is actually beneficial to us. Imaging is not as useful as we think for orthopedic conditions. For other medical conditions, absolutely. But for musculoskeletal injuries, and more specifically those at the wrist and hand associated with tendons, they don't really offer much value and can be shown through all the research that I already referenced. Abnormal imaging has been reported in various tendons in as many as 59% of asymptomatic individuals, so people that have no pain or issues with their function, which means that even if they found your tendon to be pathological, it provides no predictive or diagnostic value. And in many cases, when tendons are appropriately loaded through rehabilitation, there's often more healthy tissue in the tendons than there are pathological tissue. More healthy tissue when you perform the exercise appropriately for the tendon to allow it to positively adapt, which means the focus should not be trying to change the pathology within the tendon, but instead focus on the tolerance to demand or stress. All of the tendinopathy research has continued to support this, and this has been exactly what we have seen in all of our cases. What you should focus on is 1. Performing endurance-based protocols to improve the tendon tissue's capacity. 2. Minimize overstressing the tendons. And 3. Make changes based on how you're responding to the exercises, so increased pain and stiffness, etc. And this again does not mean imaging is useless. It just needs to always be placed in the context of the overall clinical picture to help guide decisions. And what we've seen is that it is a better tool for ruling out problems than ruling in. It can better tell us if there's not a problem than confirming if there is one. So what can you take away from this? Don't worry about your imaging results. If you have a doctor's appointment, make sure there has been a thorough examination that has been performed. And what I mean by this is there should have been physical tests to assess your muscular endurance and capacity of specific muscles you're using based on whatever it is that you do. There should also be clear identification of the pain pattern and pain behavior with different activities. And of course, assessment of your lifestyle, daily movement patterns and behaviors, and even beliefs that could lead to increased stress on your hand. If your clinician wants imaging, make sure the diagnosis provided includes the context of the examination details that I just listed. If it is not taken into account, then you should find a better clinician. And most importantly, understand that for a majority of wrist and hand issues, the tendons are involved. The best approach with the evidence that we have and the current research on tendon recovery is to manage how much stress is being applied, that load, and to build up your tissue's capacity. If you want to learn a lot more about the science of RSI and what you can do exactly, check out this video here.